Hello everyone, and welcome. Today, we're diving into high-yield, board-style medical surgical exam. Let's start with a client with heart failure, presenting with shortness of breath and pink, frothy sputum. These are signs of pulmonary edema. As a nurse, your priority is to place the client in high Fowler's position. Next, a client with cirrhosis becomes confused with abdominal distension and elevated ammonia levels. This indicates hepatic encephalopathy. Early intervention is critical to prevent coma. Consider a post-operative patient who becomes restless and short of breath. Think pulmonary embolism. Apply high-flow oxygen immediately. For a client on heparin therapy with a sudden drop in platelets, stop the heparin infusion. This could be heparin-induced thrombocytopenia, a potentially fatal condition. A client with acute pancreatitis shows confusion and a positive Kvostek's sign. This suggests hypocalcemia. Check serum calcium levels first. In COPD clients, careful oxygen administration is key. If lethargy occurs, prepare for arterial blood gases to check for CO2 retention. After a thyroidectomy, hoarseness and stridor suggest airway obstruction. Call the rapid response team immediately for airway emergencies. A client with a C6 spinal cord injury develops a headache and flushed skin. Suspect autonomic dysreflexia. Check for bladder distension first. A type 1 diabetic with nausea and fruity breath may have diabetic ketoacidosis. Check blood glucose and ketone levels to confirm diagnosis. A client with a mechanical mitral valve replacement should avoid ibuprofen. Reinforce acetaminophen as the safer option to prevent bleeding risk. For burn clients with low urine output, immediate fluid resuscitation is needed. Post-pituitary surgery, increased thirst and urination suggest diabetes insipidus. Monitor INOs and communicate findings quickly. In Guillain-Barré syndrome, shallow breathing signals respiratory muscle involvement. Immediate action is needed to protect the airway. Continuous bubbling in a chest tube's water seal chamber indicates an air leak. Troubleshoot the system and notify the provider. For chemotherapy clients with oral pain and white patches, suspect oral candidiasis. Provide oral care with a saline rinse to support healing. In every case, prioritize what saves or stabilizes the patient first. Oxygenation, airway, circulation, and neuro changes are non-negotiables. Stay sharp, trust your training, and always ask, what's the most immediate threat to life? Every one of these cases is grounded in clinical reasoning, and in every question, the principle remains the same. Prioritize what saves or stabilizes the patient first. Oxygenation, airway, circulation, and neuro changes are non-negotiables. Stay sharp, trust your training, and always ask, what's the most immediate threat to life? If you found this helpful, don't forget to like the video, subscribe to the channel, and hit that notification bell so you never miss an update. Thanks for learning with us. Now go out there and conquer the NCLEX with confidence.